Good morning, everyone. Welcome to the April 25th, 2022 in-service on seniors and their immune system presented by Adriana. For those of you who are attending, please make sure you are muted. And I'm now going to turn it over to Adriana.
Hello, everyone. Thank you for being here this morning. Today, I'm going to talk about seniors and the immune system. So by the end of this presentation, you should be able to understand how the immune system works, identify factors that have a positive or negative impact on the immune system, and develop a plan to strengthen the immune system of our seniors. So how does the immune system work? Well, you have two types of immunity. One is innate and the other is adaptive. You are born with innate immunity. It is the oldest protection we have. They encompass physical and chemical barriers in addition to other cellular components. Adaptive immunity is going to be, or acquired immunity. It has several names. It just depends on what textbook you use or how you learned it growing up. But it does have several names. And basically, it is something that we acquire when we are born. Some of it is passed down from our mothers to us via her antibodies. And we can also get adaptive immunity via exposure or vaccinations is something that is commonly acquired. Immune cells do originate from the bone marrow, but they will differentiate and mature either in the lymph nodes or the thymus, depending on their function and their purpose. So a little bit more about the innate immunity. It is basically your first line of defense. Your skin is a physical barrier in addition to any lining in your lungs or your GI tract. Anything that has a cilia to remove or detect a foreign invader is a physical barrier that's there to alert your body of a potential pathogen. So think about your skin. It's the first one. You're born with this, and you should never, ever, as one of my professors said, underestimate and compromise epithelia. So it's definitely one of the physical barriers that we're commonly using. It also has a way of releasing a sort of antimicrobial protein. So it's a pretty great defense. Chemical barriers, sweat is a chemical barrier, saliva, tears, what else? Oh, the GI secretions that we release that are extremely acidic, it's a chemical barrier. So in addition to obviously helping us break down food, it promotes that chemical barrier. It is extremely rapid acting in order to prevent this microbial invasion from occurring. It can be anywhere from minutes to a few hours, but if you've ever noticed redness or swelling, that is something that is indicative of your innate immunity working. And so just whenever you see it, just know that your body is doing, its job. It's most basic, most, form of protection is occurring. So something that you should all be aware is that it does have no specificity, meaning that it's more like an autopilot. It basically is just looking for something that doesn't belong there and trying to get rid of it. It doesn't need an antigen to say, hey, this doesn't go here. It just recognizes that it's different. And white blood cells and dendritic cells are going to be your main cells that detect this. White blood cells are going to be neutrophils, macrophages, basophils, eosinophils, all of those white blood cells that have a nucleus or that are multi-lobed. Those are the ones that we use. Dendritic cells are kind of exciting in the sense that they live within your skin area or close to the top, and they kind of look like a star, and they swoop every now and then to the surface and come back down. They're kind of like security guards of your body, if you really want to think about it in that way. They're making sure that everything is good, and if it's not, and they detect something different, they can take whatever they found to a cell or present it and then say, hey, does this belong or does it not belong? So it's a great potent cell. As I mentioned, innate immunity is going to focus on tissue repair, and that is why you see that swelling and redness of your skin, because it doesn't want any damage to occur to your body. And I think it's a wonderful way of seeing your body caring for itself. In addition to not being nonspecific, it does have the ability to do pattern recognition receptors. Basically, it's these receptors, and whenever they bring something that's not supposed to be there, it's activated in a sense. And the most common form of this receptor is a toll-like receptor. It will present the majority of antigens to cells, and it's able to recognize pathogen-associated molecular patterns which bacteria have and other viruses have. And if they're not able to, then this bacteria or virus can get away with not being detected, which a lot of these resistant microbes have developed a way to deceive our innate immunity and infect us and cause illness. So that is innate immunity. Just a quick rundown. It's not specific, and its first line is very quick acting. Then you have adaptive immunity. It's something that's a little bit more fancy. It's more specific. It's extremely delayed because of that specificity. It's waiting for antigens to come and tell it to turn on. So it is going to take about 72 hours or so. And when the body encounters an exposure, it's going to make a memory cell. And when that memory cell is activated by another similar exposure, then you're going to have this activity and it's going to combat. Memory cells are usually lymphocytes. I don't know if you've ever seen it, but it's kind of like a circle and it just has like this huge nucleus, and they look kind of they're a white blood cell basically. And you have either T cells or B cells. T cells are going to cause a cell-mediated response. They're going to do cytotoxic effects and then also release cytokines to recruit other helper cells to come to that infected site. It does mature in the thymus, even though it originates in the bone marrow. Then you have B cells that are going to, originate and mature either in the bone marrow or lymph nodes, depending on their specificity and their function. B cells are going to be immunoglobulins, or if you think about them, IgG, IgA, or IgE, which causes your allergies. Too much IgE causes allergies. If you don't know, now you know. And basically it's this humoral response. It's fine-tuned, it's gonna wait for that antigen, and then it's gonna go target and phagocyte that microbe. You have major histocompatibility complex, specifically to your T cells. And T cells are gonna be, their ability to function and work is gonna be inherited. There's some races that have a deficiency in something, or some other person, depending if they're boy or girl and what their parents passed down to them, that's going to be something they inherit. They can learn to detect certain things, but it is overall passed down from your parent. B cells, they have this art where they can do somatic recombination and kind of change and fine tune themselves for something specific. But whatever you inherit as regard to your MHC, that is how you're either going to have a really good system or a poor system. It just depends. And you have MHC1, which is basically going to have CD8, and CD8 are going to be a cytotoxic effect, which means you're going to kill something. And it can be presented to them by macrophages, B cells, and dendritic cells. And basically these cells that present them can cut the protein, present it to the CD8 receptor, and turn on that effect. You also have MAC2 or CD4, and these are going to be more of a helper effect. They're going to recruit other cells to come and kill that infection or combat it. And any nucleated cell can activate this receptor. That's why it's a little bit less specific. It does more of a help than the killing, because MHC1 is more about that, kill. So that's adaptive immunity, and it's more fine-tuned, a little bit more delayed, but it is something that as we age and grow, we can, survival of the fittest, and it allows us to live longer because it's more, I guess, delicate. This is an overview of innate and adaptive immunity. Remember that innate has those physical, chemical, and cellular defenses and barriers. Adaptive immunity is going to either be active because you've exposed yourself to something, or passive from your mother, and or a vaccination. Active is also a vaccination form. So these are the two recaps. So what weakens the immune system? I'm going to focus primarily on the dark blue kind here, but we'll talk about them all briefly. So you have immunosenescence, which is basically the impact of aging on the immune system. You have comorbidities such as allergies, infections, and diabetes. I'll talk about these three specifically because it's something that we commonly experience and can notice whether or not a person is at risk to being compromised. Medications, specifically steroids, they kind of hand it out like it's candy. We should be very cautious with how a patient, specifically seniors, are given this medication. Failure to thrive is something that is commonly seen also in seniors. It's extrapolated from the pediatric population, and is physical and cognitive decline. Malnutrition is something that is also commonly seen in our seniors, and if they don't have the proper nutrition, they don't have the strength, and that weakens them. Poor sleep can be due to the fact that we're also aging. We have a shorter circadian rhythm. Anxiety and stress can be due to either emotional or physical factors in their life. Smoking and alcohol is not good for anyone of any age. And so making sure that they're not smoking and drinking too much alcohol, it's a way to, preserve what immune system they do have. Low outdoor exposure, not only because they don't get that vitamin D, which is also a nutrient that their body needs to be healthy, but low activity. They need to be able to exercise, because exercise has a positive impact on your immune system. And if you can't do that, then your system is going to be weakened. So I'm going to focus on these really briefly, on the ones that are darker at the top, and then I'll just go into depth with those. If you have any questions about the other ones, I'll be happy to answer it towards the end. So immunosenescence, or basically effects of aging on the immune system, is going to affect the innate and adaptive immunity. Innate immunity is affected because there's going to be a decrease in immune cells, specifically neutrophils and macrophages, which make the majority of the cells. Neutrophils are about 60 to 80% of the cells, and then macrophages are going to be these massive cells that come, and then they also, engulf the pathogen. Monocytes, which become macrophages, are also going to be reduced. So that line of defense that is necessary is decreased. However, dendritic cells, which, like I mentioned, are the security guard of your body, constantly making sure that there's not a foreign invader, that remains. In addition to a specific type of natural killer cell activity, you have the dim and the bright when you're younger. The dim can actually release cytotoxic effects, but it has decreased cytokine effects, whereas the bright one has high cytokine effects and low cytotoxic effects. So when you're older, the only one that you kind of keep is the dim one. So this yin yang combination is, no longer there. There's something important to note, because even though your innate system is compromised, you can still present antigens to possibly your adaptive immunity. So when you can't combat something, as you get older, you have to rely on your memory, like on your memory cells or vaccinations. It's the most important way, because if you have a decrease of the most important cell that is in charge of eating this microbe, then you're going to have to heavily rely on your cells that are adaptive and more fine-tuned and specific to take charge. Adaptive immunity is affected, though. The thymus size does increase, and the increase does not mean it gets better. It affects the way that T cells replicate and the way that they're regulated. In addition to their signaling, it's decreased. So it's not going to be able to do that cytotoxic immediately effect, or any other things that it does with recruiting help. That's why, cytotoxic effects remain, which means it can kill, but they can't really do the helper portion of it. B cells, on the other hand, even though they're not undergoing a size change because their organ where they mature and differentiate is not as affected, their numbers are still declined because precursors are declined, in addition to the amount that is found throughout their body. And the antibody response also decreases. However, your body is going to heavily rely on B cells, because this whole thymus change affects the way that the T cells are going to mature or differentiate. So that's that, limiting step. So our patients can definitely benefit from vaccination, specifically because B cells are going to be active, and dendritic cells can still present to either, can still bring that ligand to activate the antibody. So it's important to note that even though as we age, we weaken, we may be able to benefit from abusing the adaptive immunity, in a sense, if you can say that. A lot of people don't think about allergies as being a compromising situation, specifically in not only elderly, but all individuals. They are basically an overactive immune system. And that means that your body is thinking that certain things found in the atmosphere are an invader. So your IgEs are going to be ramped up. And when you have an overactive immune system, it's working towards something that's really not causing you harm and can affect daily activity, your sleep. The medications that are taken to prevent this have anticholinergic risk, which can affect our seniors and cause falls. They're already not as full of secretions. They have a limitation of it. So giving a medication that affects them can do more harm than good sometimes, but you want them to sleep and have regular daily activity to be able to go outside or, come to the center and get, their food. So medicate them is important. And if you don't get it under control, they're going to be susceptible to ear infections, nose infections, and upper respiratory infections, all of which can eventually, make their way down and cause a pneumonia. It's never fun. So allergies are definitely something that weaken our system, even though we don't think of them as that. If you are afraid, I know that when I go to my doctor, they say local honey is a natural way of doing it. However, our patients are diabetic, so maybe not recommending it for all, but keeping that in mind, that if you buy local honey from the farmer's market, it can definitely help with your allergen, tolerance. So allergies definitely weaken our system. Infections, specifically as you get older, you're going to be more susceptible to infections. Remember that your innate system is not working as fine as it used to be. Neutrophils are decreased, macrophages are decreased, all of which engulf a pathogen or a microbe, whenever it does encounter it. So their decrease definitely, allows bacteria and viruses to colonize. So the difference between bacterial infections and viral infections is that bacteria can be treated with antibiotics. They have a specific target. You're able to ideally treat the infection and rid the individual of, whatever quality of life it's affecting. Whereas viral infections are going to rely heavily on your immune system, because viruses use your host cells to replicate, grow. So targeting our cells is only going to be doing us harm. So viruses rely heavily not only on innate if you don't have a vaccine, you're going to rely heavily on innate. And remember, our elderly patients, their innate system is already compromised. So their adaptive immunity, which is something that they rely on, if there's no vaccine, they can't really get over that hump. And so virus infections are much, much more dangerous. Commonly, you'll see patients have urinary tract infections. It can be due to hygiene or inability to, do normal functions. So common UTIs can also lead to common antibiotics. Pneumonia and influenza is considered to be the top 10 causes of death in individuals over 65. Pneumonia can be also be caused by influenza, which is a virus. Remember that they require that adaptive skill to be able to rid themselves of this virus because their innate is compromised. And COVID-19 is specifically considered a poor prognostic if you're over the age of 65. Any viral infections that can be treated with a vaccine would be ideal because they don't have that innate working at its peak. In addition to vaccines, recurrent antibiotics exposure leads to resistance and C. diff, which is another co-infection that is going to be affecting their immune system. So infections are just not ideal. Getting them the proper care before they get these infections, or teaching them, how to, wipe properly, or their caretakers, COVID-19, getting all of the boosters that they need, it's important. And minimizing the use of antibiotics so they don't develop a resistant strain, which can then lead to poor response to treatment. And then that could lead to sepsis and then eventually death. So we don't want that to happen. So infections are a major risk. Diabetes is something that many people don't remember, that it is an immune system disorder. Your body is unable to respond to insulin, and insulin is this hormone that is able to use glucose for storage or energy. And if your body cannot use glucose as its main source of energy, it's going to be weakened. So it's going to use other, it's going to use fats, and it's going to promote, ketoacidosis, which is going to cause other hospitalizations and other effects. So you want to make sure that our patients are controlled, because diabetes is, an issue that many of our seniors have and can definitely affect the way that their nutrition is absorbed and the way that they expand the energy that they have to them. Because if they're not using the proper source to use their energy, then they're not going to be strong and their immune system is going to be compromised. The diabetes is something that can definitely affect that. Our immune systems are compromised and we can't use our energy to be strong. Steroids are like candy. Everybody gets them. If somebody's wrong, if you're in the ED or if you go to the clinic, they'll give you a taper depending on your response. Usually they're not on it for very long, but some patients who are going to be on 2 mg per kg a day or more than 20 milligrams of prednisone for more than 2 weeks can be considered to be immunosuppressed. However, depending on the cortisol levels that each individual makes, being on 5 milligrams for a week can cause immunosuppression, or being on 5 milligrams for 3 months can cause immunosuppression. It's just something to be cognizant because everybody responds differently. They have a different baseline of cortisol levels. So not a prolonged steroid does not mean that they're at higher risk. A short course is also high risk. So be aware of that. It has CNS effects, as in they feel really high energy. They have a euphoric effect. And sometimes they can even have hallucinations. So if it is affecting the way that they are cognitively, insomnia, which is going to decrease their sleep and weaken their immune system, but it does increase your appetite. However, if they have any type of diabetes, it's going to also increase their glucose levels. So making sure that steroids are on only if necessary and taper them off to make sure that they don't have any type of adrenal suppression issues. Steroids affect the body in several ways, all the systems, and so they can definitely weaken your immune system. Just be cognizant of that. A lot of patients are going to be failure to thrive patients. They're going to have cognitive and physical decline. If they have cognitive decline, they're not going to be able to properly care for themselves, get their medications, or feed themselves. In addition to physical decline, they're unable to be active and be outdoors, which is going to weaken their bones and muscles. So overall, this encompasses threat to the immune system. So it's never good to have a patient who cannot take care of themselves unless they have help from someone that can make sure that this decline is not going to be fatal in any way, shape, or form. So it's not supposed to be what weakens the immune system. It's supposed to say what strengthens the immune system. Sorry about that. So what strengthens the immune system? Vaccinations, proper nutrition, and physical activity. I know we talked about the ones that can weaken it, but we should now focus on what we can do to strengthen it. That is the wrong word. So sorry. So also controlling comorbidity is extremely important. Adequate sleep, in addition to smoking and alcohol cessation, because it does no one any good to be on alcohol or to be smoking. So we're going to talk about vaccinations, proper nutrition, and physical activity as a way to strengthen, not weaken your immune system. So vaccines, remember I said that individuals who are over the age of 65 are considered to have a poor prognosis if they do get COVID-19. Getting all of their shots and their boosters just so they can be a little bit stronger is extremely important, because as I mentioned, their innate system is compromised. So a virus can definitely thrive here and take over, in the sense that if they don't have memory cells to understand what's in their body, their innate cells it's not going to be strong. There's no neutrophils, there's no macrophages, and so they can't really do much. They can't engulf these cells that have been infected by a virus. The flu as well, it's another virus, and it's a high risk of death, not only for the elderly, but also for younger individuals. So getting the vaccine is extremely important for not only the flu, but pneumococcal. They have all kinds of strains. They have the new ones, they have the 15 and the 20, but if not, getting the 23 or the 13 is extremely important. Herpes zoster, or the shingles, it was on back order when my grandpa needed to get it. I think that they've gotten control of it and it is available. So getting in the herpes zoster, especially if they had the chickenpox, because it does live in your B cells, and any stress or weakness can cause flares, and it's extremely painful. So getting them that protection is extremely important. And Tdap, you get a booster. I get a booster every 10 years. So making sure that they're up to date with the Tdap, which can cause other type of infections. If you notice, all of these are going to be more so dealing with, well, the other ones, Tdap, pneumococcal influenza, and COVID-19, they all deal with some sort of respiratory issues. Secretions are not made as properly. We don't have the proper protection. And so making sure that we are covered in that area is a way to strengthen our immune system. And it's usually, I think, depending on their insurance, is affordable for them. So nutrition, remember that malnutrition has a negative effect on the immune system. So if we have proper nutrition, which is required for healthy aging, we can definitely strengthen our immune system. Malnutrition is extremely common in seniors, about 60 to 80% of them, and it's also been linked with morbidity and mortality. And if you have malnutrition, you have even more decrease in T cell deficiencies. Remember that our thymus is already not at its best. So if you're malnourished, it's going to be even more affected. You want to make sure that patients are going to be gaining proper amounts of vitamins A, D, E, K, vitamin C, B12, folic acid, copper, iron, and selenium. I underline selenium because there's been some studies that show that this trace element has antioxidant properties, which decrease inflammation and strengthens or boosts the immune system. So selenium is a great trace element to add to the diet. And all of the above, though, are needed for just normal function. So making sure that they're taking either a multivitamin or they're eating enough nutrients like nuts, salads, chicken, they can definitely benefit from that. But nutrition is definitely something that's harder with our elderly population just because things are not as tasty. So it's a challenge, but it can definitely be something that we can help with, specifically with the Meals on Wheels. Physical activity, it's going to be dependent on the ability of the individual. We should never cause or push anyone to a limit in which it's going to cause them harm, because too much exercise that they're not used to can actually affect them in a negative way. So every physical activity should be catered to their individual ability. It's shown, actually, certain studies have shown that there is a transient elevation in immune cells, specifically the CD8 T cells and the natural killer cells. Remember that T cells are going to be a little bit compromised because of the thymus change. So if we can increase them, which have that cytotoxic effect and can kill cells once they come into contact, it's extremely important. They do notice that if a patient had patients had flu shots and if they did exercise, they were able to improve the memory cells that were made for the flu shot. It's all dependent because it does decrease pro-inflammatory cytokines and can alleviate any of that pain, any of that active use of immune system that they don't need. And then outdoor activity equals sun exposure, which activates your vitamin D, which is extremely important to them because it's a nutrient that they also need for their immune system to be strong. So in summary, the immune system is a multifactorial, system in the end. Many things can contribute to its weakening and its strengthening. So focusing on, what we can control, like vaccination, nutrition, and physical activity to strengthen, you always want to start small and go big. And so even though aging does affect the immune system and we cannot avoid that, trying to make sure that they're always eating right, they have at least some minimal movement to their ability, and are getting the vaccines that they need based on their age and comorbidities is something that we can do to help our seniors. These are my references, and I will gladly answer any questions you may have for me. Oh no.
I am going to give it a few. If anybody has questions, they can either unmute themselves or ask. So I'm giving it a few seconds, Adriana. There might be none.
I thought it was a question. I'm like, Judy's grandson is such a cutie, but no, that's not a question. Sorry.
All right, I see no questions, so I'm going to let Adriana off the hotspot.
Thank you for coming.